There is an unseen vigil across Africa, endured in the daylight, suffered in darkness. It is a wait for life itself. How often do we think about blood, the river of hope that keeps our hearts pumping? The truth is, we don't think about it enough until it's too late. Across the world, transfusions help save countless lives each year. But nowhere is blood donation more important than on the world's poorest continent, where the challenge of making sufficient and safe blood available appears overwhelming. Today, Africa carries 10% of the world's disease burden, but its blood banks remain empty. Here in Ghana, patients must ask a relative to donate the necessary blood to cover their stay in hospital.
You cannot run a sustainable system with the family replacement system. I have had first experience where somebody's lost their life because there was not enough blood available. The main challenge is getting voluntary donors to donate the blood. You need to put in strategies to make sure that blood is always available on the shelf in all the various blood groups in adequate amounts.
In the face of a lack of donors, local doctors are left searching in the dark for answers. But the solution may be closer to hand than many think. By the end of this decade, a remarkable 930 million Africans will own a mobile phone. A technological miracle that can also be tailor-made to save lives. In South Africa, SAP has created an app which could revolutionize the blood supply. An innovation that will gather vital big data, mapping blood availability and need for the first time.
How do you attract people to come forward and do blood donation, but also how do you retain the blood donor? If a blood donor drives through a township like this and there's an acute need for a specific blood type in this community, the app will actually give a message and say, can you consider donating blood? This is a perfect example of innovation in Africa for Africa.
The SAP app would also function as an educational tool, enabling rural Africans to overcome the heavy burden of stigma and superstition.
People in Ghana are reluctant to give blood because they are afraid to know their status, whether they will come out HIV positive. So they don't even come in to donate, which worries us a lot. I feel so happy when I'm taking someone's blood. I appreciate the person giving out the blood.
We've had a lot of research done now, and we've seen that for some people it's superstition. They think they might lose some power, they might become impotent, so a lot of it is education.
Using SAP mobile technology to boost critically low blood banks could impact the area of life that matters most. With the world's fastest growing population, Africa also has the highest maternal mortality. Over half of the world's deaths from severe bleeding in pregnancy occur here, leaving the journey to hospital far from a straight road.
It's important, if we need to address issues of maternal health, to make sure that blood is available on site, is accessible and is timely.
But technology's greatest power remains its enduring reach. Across not just countries, but entire regions. A factor that could unite nations in health.
Having big data available with this blood information can facilitate one country supporting another country in case of an emergency. It's a whole new dimension of transforming the well-being of communities by using technology.
The walk towards motherhood is that most defining of all human journeys. Fraught with fear and hope, it is a path we should never take alone, and through which we come to understand that most famous of African proverbs: It takes a village to raise a child.
Allah jarabina, mo bene jarabidum. Allah jarabina, mo bene jarabidum. Ali mana jarabide yo, ali mana jarabide.